If you think that you are too young to worry about your cholesterol, take a look at this. A new study finds that every decade you have elevated cholesterol between the ages of 35 and 55. Your risk of heart disease could jump by 39%. Wow. Our Dr. Tara Narula is with us at the table to explain the study and what we need to worry about. Do you find that most people in their mid-30s are even thinking about their cholesterol?
No, I think that's the big problem. A lot of people in their 30s and 40s, they don't know what their cholesterol is. They're not worried about it. And this study really suggests that they should be, or that doctors should be a little more aggressive about treating it. The study looked at around 1,500 patients who were the age of 55 and free of cardiovascular disease at that point. Then they looked back to see how long these people had had elevated levels of cholesterol. And the longer their cholesterol had been elevated, whether it was 10 years or 20 years, the higher their risk became after the age of 55 of developing a heart attack or stroke. So they made this akin almost to pack years of cigarette smoking or sun exposure. You know, that the longer you have these elevated levels of cholesterol, the more and more damage you're accumulating in your cardiovascular system.
When are you supposed to start getting your cholesterol checked?
The recommendation is to start at age 20 and to have it checked every 4 to 6 years. So that's very early, and I think, you know, a lot of 20-year-olds don't know that and are definitely not getting it checked that early.
How common is it that people in their 30s have high cholesterol?
It's relatively common that you could see, especially with the elevated rates of obesity in this country. You know, we know that that can drive up your cholesterol levels, and we have an obesity epidemic. So, you know, it's more and more important for people to be aware of this at these younger ages and start prevention efforts early.
But don't you, when you get your annual physical, I mean, I know when I go get my annual physical, they test your cholesterol. Shouldn't that be one of the battery of tests that you get in your physical?
It should. That's the point, is that every 5 or so years, you know, you should be having it checked, and your doctor should be counseling you on the lifestyle interventions that are important to lower your cholesterol.
All right. How do I know when I need treatment? Quickly, you have a quick answer for that?
Yeah, it's a great question. So we usually calculate your 10-year risk score of having a cardiovascular event, and we do that by looking at your age, your gender, your blood pressure, etc. And if your risk score is over 7.5%, then we suggest maybe drug treatment for you. But diet and exercise, weight loss, stopping smoking, these are all the important things for younger populations.
And later, statins.
Statins are the miracle drugs, but they haven't been tested in a 30 to 50-year-old age range who are relatively healthy yet.
All right, Dr. Tara Narula, good information. Thank you so much.